What is goiter? Goiter is the irregular growth of the thyroid gland. The thyroid is a butterfly-shaped gland located at the base of the neck just below the Adam's apple. Next, we will talk about what causes goiter. Goiters have different causes depending on their type. First, simple goiters develop when the thyroid gland does not make enough hormones to meet the body's needs. Second, endemic goiters occur in people in certain parts of the world who do not get enough iodine in their diet. Third, sporadic goiters in most cases have no known cause. In some cases, certain drugs can cause this type of goiter, for example, the drug lithium. There are some other factors that can cause goiter which are hereditary, which is inherited from family, female gender, age over 40, grave disease which is an autoimmune disease, Hashimoto's disease also an autoimmune disease, nodular goiter, thyroid cancer, pregnancy, thyroiditis and exposure to radiation.
The most common symptom of goiter is a swelling in the front of neck, just below the Adam's apple. Next, the symptoms are divided into two categories. There are underreactive thyroid hypothyroidism and overactive thyroid hyperthyroidism. The symptoms for hypothyroidism are fatigue, increased sensitivity to cold, increased sleepiness, dry skin, constipation, and also muscle weakness. For the hyperthyroidism, the symptoms are sleep difficulty, weight loss, rapid heartbeat, increased sensitivity to heat, excess sweating, and high blood pressure.
Next, we will talk about goiter prevention. Firstly, we can use vaccination method. In this method, MMR, which stands for mumps, measles, and rubella vaccine, are used. In Malaysia, the first dose of MMR vaccine is given to the baby aged around 9 months. Then, a second dose is given after the baby is aged around 12 months old. Apart from vaccination methods, there are also dietary style methods. This type of method must follow the type of thyroid that the patient is suffering from. For hypothyroid patients, they need to increase iodine intake in their food. Examples of suitable foods are iodized salt, fish, and eggs. For hyperthyroid patients, they in turn need to reduce iodine intake in their food. Examples of foods that are suitable for them are non-iodized salt, fresh or canned fruit, and non-dairy products.
A goiter need treatment depends on the answer to the three key clinical questions. If the thyroid is so large as to cause symptoms by stretching or compressing a junction structure, or it is so big as to be unsightly, surgical removal of the thyroid gland or thyroidectomy may be required. If the goiter is related to a condition causing hyperthyroidism, as in grave disease or toxic nodular goiter, treatment with radioactive iodine may be effective in both controlling gland overactivity and decreasing its size. Some normally functioning or non-toxic nodular goiter can also be shrunk with radioactive iodine therapy. If the thyroid is enlarged as the result of autoimmune Hashimoto thyroiditis and the gland is also underactive with a high blood TSH level, then starting thyroid hormone medication, L-thyroxine, may both treat the hypothyroidism and partially shrink the gland. Alright, let's take a look on example case of goiter. Regarding to International Journal of Surgery case report, present a case of 47-year-old female with multinodular goiter with a rapid increase in size within 2 years. She also reported palpitation, breathlessness on exertion, tachycardia, and hand tremor. Computed tomography CT scan of the neck shows a gross enlargement of thyroid gland across both sides of the neck. The fine needle aspiration, cytology, and final histopathological examination were suggestive of MNG with edematous nodules and toxic changes respectively. A total thyroidectomy was performed and the gland was resected successfully.